Mr. President and Vice President of the 75th World Health Assembly, Director General of the World Organization, Excellencies, Honorable Ministers, Ambassadors, ladies and gentlemen, I share these words on behalf of my fellow ministers and colleagues from the Pacific. A quarter of a century ago, our predecessors in the Pacific dared to dream of a better future. The healthy island vision they created is one in which children are nurtured in body and mind. Environment invites learning and leisure. People work and age with dignity. Ecological balance is a source of pride, and the ocean, which sustains us, is protected. Mr. President, there is wisdom in these words. In the same way that health is not merely the absence of disease or infirmity, peace is not merely the absence of war. The women and men who set that vision years ago knew that true peace and prosperity only come when we overcome inequities, when we protect the planet that sustains us and the source of our pride, and when all of us, from infancy to our elder years, can live healthy and fulfilling lives. Can we truly say we are at peace when some countries, particularly small island states, continue to sink beneath the rising waves? Can we say we are at peace when we continue to pollute our oceans and poison the fish and marine life that are vital for our economic and food security today and into the future, and hold one of the keys to ending hunger and poverty? Is a parent at peace when a child is ill but cannot access the treatment so easily available to others? Is a breadwinner at peace when he cannot even make the $1 a day to provide for the life of his family? Even in the most traditional sense of peace and war, we know that conflict thrives under condition of inequity and of struggle over limited resources. As our climate changes, leaving some areas parched with others submerged, we will see further impacts on both our security and our health. Mr. President, this is why our predecessors so wisely knew we need to work toward that broader concept of peace based upon fairness, environmental stewardship, and health for all. The chasm between the cannot do and can do, between the able and disabled, between the rich and the poor, the healthy, unhealthy, must be narrowed and become a thing of the past. To succeed in this, we need the backing of a strong and independent WHO. We must all have a say in setting the priorities of the global health programs which are supposed to serve every member state. That is why we welcome the discussion on the sustainable financing of WHO. For WHO's support has been essential in the Pacific. We would like to thank our WHO colleagues and partners for your ongoing assistance, particularly during this pandemic. There are mothers, fathers, children, and friends who are alive today because of you. Thanks to the advice you shared, the partners you coordinated with, and the 160,000 kilograms of medical equipment and supplies you sent. To conclude, I want to remind us all of the broader definition of peace and the vision of a healthier future set by those who came before us. We in the Pacific will continue to work alongside our fellow member states as we strive toward a fairer, healthier, and more peaceful world. As we continue to extend to all peoples we seek from each peace, friendship, cooperation, and love in our common humanity. We cannot achieve a state of complete physical, mental, and social well-being if peace throughout the world is not our common purpose. Peace, peace, peace. Thank you.
Je vous remercie.
Thank you. I now give the floor to the delegate of Mauritania.
بسم الله الصلاة والسلام على رسول الله سيد الرئيس سيد المدير العام لمنظمة الصحة العالمية
Mr. President, Director General, Ministers, Ambassadors, it is an honor for me to speak at the 75th World Health Assembly. On behalf of the Ministers of Health of Arab countries, we would like to wish you every success in your work, and I congratulate the President of this Assembly on his election as President, and I would like to congratulate the Director General of the WHO, Dr. Tedros. For the achievements, his achievements to the present day, and we congratulate him on his re-election, which we support. We would like to overcome all obstacles that we have suffered from over the past 2 years, in particular the COVID-19 pandemic. We would like to commend the COVAX initiative, which ensures vaccines for all countries rapidly and equitably, and we'd like to express our appreciation for the WHO's efforts, which enable countries, in particular Arab countries, to benefit from technologies that produce vaccines, and particularly mRNA vaccines. We believe in Arab countries that it is important to support this organization so that we can deal with health emergencies through measures to respond to health emergencies across the Arab world, and to do so through a vision that enables us to strengthen prevention. In fact, we have adopted strategies to support this vision. As you know, through the credible reports of WHO experts, the health situation in the occupied Palestinian territories is deteriorating, and quite seriously, particularly as a result of attacks against medical staff and health infrastructure. As you know, this Assembly votes in favor of a resolution that condemns these attacks. And we invite you to support Palestinians. We invite you to provide more technical and financial support to Palestinians and to end the discrimination that the inhabitants of these territories experience and have been experiencing for decades. And we'd like to draw the attention of the international community to the health situation in Arab countries that is very difficult, particularly those countries that suffer from conflicts and the increasing number of refugees, which will have repercussions on our commitment to achieving the Sustainable Development Goals. We would also like to note that Lebanon needs support, both Arab and international in nature. Mr. President, I would reiterate my wish that you are successful in your work at this assembly. Thank you.
Britannique qui a parlé au nom du Conseil des ministres.
The Mauritania spoke on behalf of the health ministries of Arab countries, and now I give the floor to the delegate of Togo, who will speak on behalf of the African region. You have the floor. Thank you. Mr. President, Director General of the WHO, ladies and gentlemen, Togo is honored to take the floor on behalf of the 47 member states of the African region of the WHO on item 3 on the statement from the Director General, Dr. Tedros Ghebreyesus. The address from the Director General speaks about the main achievements of the organization over the past 5 years and every result from the triple billion goals regarding universal health coverage. And the Director General has spoke about the achievements that have been made in terms of prevention and of non-communicable diseases and the fight against antimicrobial resistance and the actions to take in the future, but also measures regarding communicable diseases and strengthening vaccination. With regard to protection following health emergencies, the Director General urged for strengthening preparedness and response to health emergencies and to strengthen the WHO programs to measure to prevent health emergencies and to draw lessons from the COVID-19 pandemic. In fact, the COVID-19 pandemic is the most serious health crisis that caused a number of deaths. Despite the reduction in cases, the pandemic is far from over, and it is important to ensure essential health services and to strengthen monitoring and vaccination. To achieve better health services and better well-being, the Director General insisted on promoting health and the progress that has been achieved in terms of maternal nutrition and nutrition for young children and infants. With regard to the topic of the 75th World Health Assembly, Health for Peace and Peace for Health, the Director General recalled the terrible consequences of war on health systems, and peace is the foundation for sustainably improving health, and he concluded by launching an appeal for peace. Mr. President, for the next 5 years, the Director General has announced 5 priorities to accelerate progress towards the triple billion goals and the Sustainable Development Goals, which are the urgently changing the paradigm to promote health and to focus on prevention, reorienting health systems towards primary health care and strengthening global health architecture for preparedness and response to health emergencies, and developing research, innovation, and the use of data and digital technologies. And finally, building a stronger WHO. The African region of the WHO commends Dr. Tedros for all of his achievements, and we encourage him to pursue the achievement of the triple billion goals for greater impact on populations. Thank you very much, Mr. President.
À vous.
Thank you.
J'appelle maintenant le
I now call on the delegate of Cabo Verde, who will speak on the behalf of the community of Portuguese-speaking countries. You have the floor, sir.
Sr. President,
Mr. President, I make this intervention on behalf of the community of the Portuguese language countries. First, I'd like to congratulate the WHO, in particular the Director General, for its commitment and the leadership that has been shown during his mandate, particularly in the past 2 years in the pandemic of COVID-19. Also, for the expected re-election, and I wish success for his next mandate. The public health crisis showed again that peace is fundamental for health and well-being of the humanity, and it's only possible in a peace moment environment. In this scenario that we have, where social inequalities are deepening in the vulnerable groups, in particular women and children, broadening the challenges to achieve the 2030 agenda, there are new and old threats to peace and security in the world, with a very challenging environment in the political and social level. The CPLP, the community of Portuguese language countries, considering that it's urgent to state to work in building a lasting peace based on dialogue and the pacific resolution of conflicts in order to continue to build resilient health systems capable of providing services for everyone, anywhere, leaving no one behind. Armed conflicts shall not affect food security of the most vulnerable peoples. Mr. President, the need of a post-pandemic work that is sustainable to overcome challenges to be according to the 6th Minister of Health meeting of the Community of Portuguese language countries, that is to reiterate the commitment with the implementation of 2030 agenda, prioritize the primary health care as fundamental instruments to promote culture and health in our countries. In these meetings, the Portuguese language countries highlighted the need to continue sharing regularly and timeless health information and good practice, aiming at surveillance, strengthening, and timeless response for health emergencies, including health system strengthening that are pertinent and accessible for population with the effects of the pandemic, with the impacts of COVID-19, the strength and work with non-communicable disease. The ministries of health agreed in the meeting the development of a timely plan to face these challenges. And we consider that it's very important the access to diagnosis and accessible treatments against COVID-19. On the other side, we recognize the vaccine as a determined factor in the response to post-pandemic challenges. With that, we stress our support to global initiatives to local vaccines production. With that, CPLP urges WHO to continue and insist in the work to partner with the countries to face the challenges in public health, and also to intensify the efforts to accelerate and improve the health systems and the universal access of health. Also, we'd like to stress the acknowledgement to all work professionals that in some way they have been assuring the continuity of the health services. And finally, the member states of the CPLP highlights its commitment with the equitative peace based on the UN Charter as a requirement for health for everyone, everywhere. Thank you, Mr. President.
Merci beaucoup.
I thank you, and I now invite the delegate of Azerbaijan, who is going to speak on behalf of the non-aligned movement group.
Mr. President, Your Excellencies, Ministers, Head of Delegations, I have the honor to deliver this statement on behalf of the non-aligned movement. Reiterating our strong commitment to the purposes and founding principles of NAM and the World Health Organization Constitution, NAM member states stress the urgent need to ensure the right of everyone to the enjoyment of the highest attainable standard of physical and mental health. NAM recognizes that persisting challenges related to uneven access to quality, safe, effective, and affordable COVID-19 vaccines is derailing efforts to eradicate the pandemic. A global emergency like the COVID-19 pandemic requires a coordinated and concerted global response based on unity, multilateral cooperation, solidarity, and respect for human rights. NAM has played a key role in mobilizing and strengthening global efforts to address the impact of the pandemic through, inter alia, convening a special session of UN General Assembly in response to COVID-19 pandemic in December 2020 and initiating the adoption of resolutions titled Ensuring Equitable, Affordable, Timely and Universal Access for All Countries to Vaccines in Response to the COVID-19 Pandemic by the Human Rights Council and the General Assembly, as well as the launching of the database of medical and humanitarian needs of non-member states in response to COVID-19. NAM welcomes the efforts of countries which have donated COVID-19 vaccines and actively encourages further sharing of vaccine doses by all countries in a position to do so. In this context, we appreciate and support the work of the COVAX facility and other constructive related initiatives to ensure affordable, equitable, universal and timely access to COVID-19 vaccines for all. NAM expresses strong condemnation at the promulgation and application of unilateral coercive measures against member states of the movement that applied in violation of the Charter of the United Nations and international law, and further express our support in accordance with international law to the states affected by such measures, urging the international community to adopt urgent and effective measures to eliminate the use of such measures, with a view to ensure the effectiveness of national responses to COVID-19 pandemic. The NAM stands ready to continue its active engagement towards the soonest possible elimination of the pandemic and effective recovery efforts. In this regard, NAM welcomes the initiative by His Excellency Mr. Ilham Aliyev, President of Azerbaijan, in his capacity as the chair of the non-aligned movement to convene the next summit-level meeting of the NAM contact group in response to COVID-19 in post-pandemic global recovery. The NAM member states reiterate their commitments to achieving universal health coverage and health-related SDGs by 2030 to ensure health security and more resilient health systems that could provide a timely response to health emergencies, particularly through integrated surveillance, building long-term capacities, and promoting progressive self-reliance strategies. In conclusion, the non-aligned movement counts on the solidarity of all states at this 75th session of the World Health Assembly to prioritize effective responses and to explore and adopt appropriate measures to ensure that the world is prepared for future pandemics. Thank you.
Je vous remercie.
I thank you, and I now give the floor to the delegate of the Lebanon, who will speak on behalf of the Mediterranean region. You have the floor.
Mr. President, Your Excellencies, Director General, distinguished delegates. On behalf of the member states of the WHO Eastern Mediterranean region, I would like to acknowledge the high priority and urgent need for health as a fundamental pillar to peace. Health and peace are largely codependent. Healthcare may be the first victim of total war, whereby health facilities and healthcare workers are targets for attacks, and health resources and services are made inaccessible to a dehumanized enemy. But let us take that concept and reverse it. Thus, provision of health becomes a route for peace. During conflict, healthcare workers providing access to a much-needed human right, and health facilities becoming sanctuaries to all without discrimination will surely create the opportunity for healthcare givers to become peacemakers as well. Countries in our region and across the globe are affected by multidimensional problems caused by conflict, such as displacement, poverty, unemployment, and inequitable healthcare access. This by itself can trigger violence or conflict. In an ever-increasingly connected world, and as with COVID, conflicts and their ramifications do not respect borders. Defined roles and boundaries are not recognized. But can we reimagine this as an opportunity rather than an obstacle? Can we redefine the role of healthcare provision as going beyond that to help building resilience where there is fragility and cohesion where there is disunity? The Global Health for Peace initiative is a window of opportunity which has tremendous potential in this regard by promoting inclusiveness and enabling access to health, a public good, and reducing tensions generated by mental or physical illness. More resilient world is built, and we, as COVID has taught us, are as strong as our weakest link. Having this conviction, it becomes imperative that we join forces towards supporting the initiative and the WHO as a sustaining peace actor. This is important for us, considering the significant number of emergencies and conflicts in our region and their toll on our people. Finally, we appreciate the efforts of the government of Oman and Switzerland in taking the lead in advancing this initiative and keeping it in focus within and beyond the region. We urge member states to support efforts towards implementing this initiative and for the Secretariat to continue to provide support and ensure effective coordination between all partners. Dear audience, COVID has refocused the attention of the whole world on the importance of health. Healthcare workers are seen for what they are: selfless, courageous, generous individuals who would sacrifice all for the benefit of all. This trust, so dearly earned, places upon our shoulders even greater responsibility. Can we now play an equally important role, the role of healers to the wounds of general strife and conflict? There cannot be health without peace, and there cannot be peace without health. Thank you.
Merci beaucoup.
I thank the distinguished delegate. I now give the floor to France on behalf of the European Union. You have the floor. Thank you, Chair. Ladies and gentlemen, ministers, heads of delegation, ladies and gentlemen, I am delivering this statement on behalf of the EU and its 27 member states, the candidate countries, North Macedonia, Montenegro and Albania, the potential candidate Bosnia and Herzegovina, and also align themselves with this statement. Director General, I welcome the work on the front line for healthcare. And the Director General, you chose health for peace and peace for health as the theme for the general discussion. Sadly, the tragic events of the past few months illustrate the relevance of this topic in our region. Russia's unprovoked and unjustified war of aggression against Ukraine seriously affects the lives, health, and well-being of countless innocent civilians. This aggression also grossly violates international humanitarian and human rights law, the UN Charter, and undermines international peace, security, and stability. That is why the EU and its member states demands that Russia immediately cease its military action, withdraw all its troops from the entire territory of Ukraine, and fully respect Ukraine's territorial integrity, sovereignty, and independence within its internationally recognized borders. We call once again on Russia to immediately stop attacks on healthcare and to allow the safe evacuation of civilians. We condemn the failure to establish and respect humanitarian corridors with the necessary ceasefire assurances. Free and safe access for those delivering medical and humanitarian assistance must also be ensured in line with basic human rights principles and international humanitarian law. These fundamental principles apply to any situation of conflict. wars and conflicts have profound and lasting negative impacts on the health of populations. They always lead to the same dire consequences: the loss of life, physical trauma and injury, psychological trauma, and various forms of abuse against civilians. We condemn in particular the practice of sexual and gender-based violence by combatants and urge and give the highest importance to the WHO continuing its efforts to support survivors with essential care. The disruption of essential health services, including for all forms of the population, include in particular the most vulnerable groups, the disruption of medical supply chains, destruction of infrastructures, including health facilities, and displacement of populations. We wholeheartedly commend the WHO for its work in the field and the tireless efforts undertaken in very complex and dangerous settings. We are also conscious that effects of war and conflicts on the health of populations continue to be felt for generations, with reduced access to schools, problems in accessing safe drinking water and food, and in particular jeopardize the health of all the population, women, children and newborns, and the elderly in particular. The ongoing COVID-19 pandemic reminds us all of the need for trust and cooperation in order to better withstand and respond to shared health threats. Peace is conducive to the flourishing of science and technology, the sharing of information, to solidarity and sustainable economic, social, environmental development. Peace, communication and trust at all levels are needed to facilitate the last mile required to vaccinate people and deliver health services in remote areas. The COVID-19 pandemic also highlighted the need for coordinated responses between peace-building, development, cooperation and humanitarian actors in the strengthening of health systems based on normative guidance of the WHO. In short, the world needs multilateralism in action to ensure health security, and multilateralism in action requires peace and trust. Chair, as you know, peace is a prerequisite for healthy populations, and a focus on health is conducive to peace. The European Union launched various programs in view of strengthening health system capacities and to support local production, distribution and administration of vaccines and other medical products in partner countries. With these initiatives, the EU aims to contribute to the achievement of the UN 2030 Agenda for Sustainable Development. Peace and health need to be at the core of the global health architecture. In that regard, we welcome the vision that you, Director General, have outlined at this World Health Assembly, and insist on the need for a safe and secure environment for global health actors, with the WHO at its centre. Thank you.
Merci, honorable député.
I thank the distinguished delegate, and I now give the floor to the delegate of Indonesia, who is going to speak on behalf of Southeast Asia nations. Thank you.
President, I have the honor to deliver this statement on behalf of the ASEAN member state. The Associations of Southeast Asian Nations, or ASEAN, as a region, is an inseparable part of an interconnected global community. Therefore, we recognize that building ASEAN health system resilient, including through applicable regional health protocols, the development of manufacturing and strengthening research networks to attain vaccine security and self-reliance during peacetimes and emergency situations will contribute to the global health architecture strengthening. Furthermore, ASEAN Leaders Summit in October 2021 noted the need for ASEAN to strengthen its capacity and institutional effectiveness to adapt to the new, emerging, and rapidly evolving challenges, and to advance ASEAN comprehensive recovery from the COVID-19 pandemic. In building such regional health system resilience and accelerating COVID-19 recovery, the 15th ASEAN Health Ministers meeting held in Bali last week agreed to the following actions. First, we will mobilizing resources by exploring an expanded regional funding mechanism for COVID-19, such as ASEAN COVID-19 Response Fund and ASEAN Regional Reserve for medical supplies. Second, optimizing and mobilizing ASEAN mechanism, such as ASEAN Emergency Operations Center Network for public health emergency, as well as establishing and operationalizing the ASEAN Center for Public Health Emergencies and Emerging Diseases to strengthen the prevention and preparedness. Third, optimizing the utilizations of regional big data analytics and global genomic sequencing data sharing platform, promoting One Health approach and exchanging laboratory readiness and response actions to detect the risks of public health emergencies. Fourth, implementing ASEAN health protocols and cross-border contact tracing and rapid outbreak investigations, as well as implementing joint statement on mutual recognition of COVID-19 vaccination certificates to enhance the region's mitigation strategies. And fifth, operationalizing the ASEAN Universal Verification Mechanism and any other mechanism created according to the World Health Organization's digital documentation on COVID-19 certificates. Sixth, strengthening access to vaccine, therapeutics, and diagnostic and other essential medical supplies through exploring and building public-private partnership network to enhance manufacturing capacity while promoting knowledge sharing among the ASEAN member states. 7, pursuing the implementations of the ASEAN post-2015 Health Development Agenda and its works programs 2021-2025, as well as fostering closer collaborations and dialogue with ASEAN partners to advance the achievement of ASEAN health sector cooperations. President, I would like to conclude by highlighting our determinations on ASEAN centrality in forging partnerships with ASEAN dialogue partners, development partners, and other partners, including with health-related private sectors. This includes in building communication and coordination with other global actors such as the World Health Organization and G20 in order to build the ASEAN community toward a healthy, caring, and sustainable society. I thank you.
Merci, honorable délégué. Maintenant, nous
Thank you to the distinguished delegate. We're now going to move on to the statements by member states, and I invite the delegate from Kenya to come to the podium to take the floor.
Désolé, c'est les délégués de la...
I apologize. It's the delegate from the Central African Republic. The delegate from the Central African Republic will be speaking on behalf of observer states, which are members of the International Organization for Francophonia. Delegate from the Central African Republic. Observers, I'm making this statement on behalf of the Organization of Francophonia. We commend the holding of the Global Health Assembly and would like to take this opportunity to commend the efforts of the WHO and its partners. However, we remain preoccupied by the pandemic, which is still an international international health concern, and we express a solidarity with countries and regions which have seen resurgence of cases, and we support WHO's call for caution faced with this threat. Faced with this resurgent, we would like to state that we support the initiatives of the WHO and its partners under the ACT initiative, supporting low-income countries to achieve sustainable development goals and access to tools to fight against COVID-19. This includes the equitable access to vaccines, strengthening stockage, as well as increasing national awareness raising and vaccination campaigns. The group also commends the fact that the Global Transfer Technology Centre of the WHO has made available for countries with low income the necessary technology and knowledge to locally produce vaccines. We encourage a boosting of an international mobilization, which will allow, through strengthened solidarity and cooperation, us to eradicate the pandemic. It is in this spirit that the group commends and supports the strengthening of the partnership between the WHO and our organization, which has been shown through the signing in 2021 of a memorandum and cooperation agreement. This will allow the two organizations to carry out decisive political and diplomatic action. These activities include actions against the pandemic and to support health personnel, in particular through the WHO Academy in Lyon. It aims to train public health actors in global health challenges. We know the work that's been done by the working group on strengthening preparation and response of the WHO to health emergencies. And we take note of the recommendations of the working group on sustainable development relative to the gradual increase of fixed contributions with the appropriate reform of governance in order to make the WHO more independent and effective. We would like to take this opportunity to commend the decision of the Executive Board to renew the mandate of the DG of the WHO. We express that we stand ready to contribute to the success of the mandate and the missions entrusted to him. Finally, we would like to recall the fundamental place of multilingualism within the UN. We commend the efforts conducted by the WHO tirelessly in this area. We highlight our availability to work together with the WHO in order to strengthen multilingualism within this organization, including on social networks. Thank you. Thank you to the distinguished delegate from the Central African Republic. I will now be giving the floor to the delegate from Kenya, and I invite them to make their statement from the podium. You have the floor.
Mr. President, addressing population health needs and expanding equitable, affordable access to quality services is the foundation of Kenya's universal health coverage program, whose primary driver is absolute health care. Kenya has made deliberate investments in primary health care by creating primary care networks across the country, supporting them with access to essential medicines, operationalizing medicines therapeutic committees, and capacity building of community health volunteers, as well as hiring healthcare workers of various cadres at the PHC facilities. These investments have in turn seen an additional 1 million indigent households per annum registered and covered under our Universal Health Coverage Scheme operated by our National Health Insurance Fund. To attain UHC as envisioned by SDG 3, more effort must be made to strengthen health systems at the community level to make them fit for intended need and use. The fact is reinforced by the experiences faced during COVID-19 pandemic and exposed weaknesses in global healthcare systems. The global community must therefore invest in health workforce, specialties, and strategic commodities that address their need and purpose. Consequently, Kenya calls for this meeting to support the multilateral organizations to actively support local manufacturing of pharmaceutical products and commodities. Global Fund, Gavi, and other key players should purchase these commodities from local manufacturing and create capacity. The COVID-19 crisis exposed the glaring inequality of research and development of solutions to healthcare matters affecting the vast lower and middle income countries. For instance, it was remarkable how within a short time, scientists as well as financiers were able to expeditiously develop vaccines and other therapeutics used in managing COVID-19, whilst infamous such as HIV, TB, and malaria continue to ravage our people in low and middle income countries. Kenya, therefore, calls on the global community and financiers to channel the same energy, efforts, and resources in developing affordable, accessible vaccines and treatments for HIV, TB, and malaria, just as we larried in developing the same for COVID-19. Colleagues, friends, peace is fundamental determinant for health. We have demonstrated that we have the tools in our arsenal to both build and destroy our common destiny. Let us choose to be on the right side of history. Let us choose peace. I thank you.
Merci, je vous remercie.
Thank you very much. I will now give the floor to the delegate from Brazil. And I invite them to take the floor from the podium.
Mr. President, dear ministers, excellencies, ladies and gentlemen. The government of Brazil defends strongly the life since its conception, freedom, peace, and respect for sovereignty of the states. Since the very beginning of the COVID-19 pandemic, the President Jair Bolsonaro's administration worked to preserve lives, balancing the social justice and economic fairness. At the same time, when we fight corruption, that withdraw the opportunities for citizens to access the health system, preventing the delivery of essential public policies. The key pillar to tackle future health emergencies consists in the strengthening of the health national systems. Brazil, as it was defended here in this assembly, has one of the biggest universal systems in the world. And during the pandemic, we invested more than $110 billion in our unified health system, what enabled us to triple our surveillance capacity and broaden the primary care. We acquired more than 650 million doses of vaccines, and over 80% of the Brazilian population completed its vaccination cycle. We advanced in the application of booster doses, and we have vaccines to assure the Brazilian people the free access to this so important health policy. In the past year, we reduced in 90% the number of deaths. We defend equally the fair access to vaccines. We donated 5.6 million of doses and more than $86 million to aid in the WHO's efforts in the broadening of the global coverage of COVID-19 vaccination. Another important element with regard to the national production capacity expansion, based in promotion of investments, technology transfer, knowledge transfer, from the possible operationalization of flexibilities. By celebrating the scientific advances and technological advances that enable us the development of vaccines and treatments, it is important to understand there was expressive profits from the industry. So it's imperative to have, in the short term, vaccines either safer, efficient, and cost-effective that assure more protection facing new virus variants. On the other hand, we already had therapeutic alternatives that are more efficient to tackle the COVID-19 progression. We will work to broaden the fair and equal access to these therapies. And finally, I'd like to register our solidarity to family members who lost someone and assure a commitment to take care of those with effects from the COVID-19, as well as those who lost opportunity for assistance in our health system. Thank you very much.
Merci, honorable.
Thank you to the distinguished delegate from Brazil. I now give the floor to the delegate of Slovenia, and I invite the delegate to come to the rostrum. You have the floor.
Excellencies, ladies and gentlemen, Slovenia allows itself with the statement of the EU and its member states. Director General, at the beginning of this year, we have finally seen rays of hope that we might be on our way out of the acute phase of pandemic. Driven by the lessons learned, we are now striving to bridge gaps that the pandemic made so painfully obvious in our health systems. These endeavors have now been overshadowed by a new conflict in the European region. Any loss of human life is regrettable, and when related to destruction of civilian, including health infrastructure, also incomprehensibly tragic. Peace is fundamental to health and prosperity. We cannot fully recover from pandemic and reach the most vulnerable while conflict rage around the world, shots are fired, and bombs are dropped. We cannot succeed with the goals set in health policies in our common values, such as solidarity and nobody left behind, are being violated. Without united and harmonized approach of all stakeholders at global level, we cannot, for example, successfully focus on climate change, endangering not only the health of our populations, but also increasing the risk of our very survival. Present crisis should be a wake-up call. We, ministers of health, and the whole health community have a duty to speak out, to warn and advise our governments while there is still someone to hear us. There is, however, a sense of optimism with several initiatives taking place to strengthen the global health architecture with WHO at the center. We should continue, based on the report of WHO, Pan-European Commission on Health and Sustainable Development, to put health and investments in health innovations high on the political agenda when discussing future developments of our societies. This is crucial, not only for advancing in health, but also for succeeding with the development goals globally. Equity and nobody left behind has been a long-standing priority for Slovenia. To overcome the present situation, to ensure access to health services for all, including those living in conflict areas, significant multilateral efforts are needed involving all civil society. Slovenia is ready to play its role in contributing to 5 priorities identifying by you, Director General, and most of all, to peace. Thank you for your attention.
Merci, honorable délégué.
Thank you to the distinguished delegate. I now give the floor to the delegate of the USA. You have the floor.
Assembly President, Director General Tedros, ministers, and distinguished leaders, on behalf of the United States of America, I am honored to address this 75th World Health Assembly. 75 years ago, U.S. President Harry Truman called on the United States to join the World Health Organization for a simple reason. The world faced urgent international health challenges, challenges that knew no borders, and that bound us together with a community of purpose. Today, we gather again with a shared purpose: to promote global health and well-being and to continue our fight against COVID-19. As the Assembly discusses health for peace, peace for health, we also stand to condemn President Putin's unprovoked, unjustified aggression against Ukraine in contravention of the Charter of the United Nations. Russia's attacks have destroyed numerous health facilities. Civilians and health workers have been maimed and killed. Disruptions in the global food system are putting millions more already vulnerable at risk of increased poverty and malnutrition. The international community must, and the United States will, continue to stand with the people of Ukraine. The quest for health and peace is not new, but it is enduring. And under President Biden's leadership, the United States is continuing this critical work every day. We are promoting universal health coverage and health equity, including advancing sexual and reproductive health and rights and addressing gender-based violence. We are working to build more resilient, accessible, equitable health systems to serve our communities' needs day in and day out. This is one of the reasons why President Biden is hosting the Global Fund's 7th Replenishment Conference, and why we are pleased that this Assembly is poised to take the first meaningful steps toward sustainable finance and improved governance of WHO's budget in many years. We are working to expand, train, and protect the health workforce, most of whom are women. We continue to combat climate change, and we will keep working with partners to support global vaccination, testing, and treatment efforts. The U.S. deeply regrets that Taiwan, a critical partner contributing constructively to global health, has been excluded from attending the Assembly as an observer. This administration believes in the need for strong global relationships to combat COVID-19 and to prevent and prepare for future health emergencies. That's why the U.S. is pleased with the consensus reached this week on concrete action and further work to strengthen existing tools available to the WHO and to all member states. This includes strengthening the international health regulations from 2005 to clarify roles and responsibilities, increase transparency and accountability, share best practices, and communicate in real time with our global partners. We are also committed to an intergovernmental negotiating body process that engages external stakeholders and develops an international instrument on pandemics that enables meaningful, inclusive action. Today, I ask for your support and collaboration as we work together to strengthen the WHO and the capacities of all WHO member states. I know we can find common ground because we share common goals, and we look forward to working with all of you in these endeavors. Thank you.
Merci, honorable délégué.
I thank the distinguished delegate. I now give the floor to the delegate of Ukraine via video conferencing. You have the floor. Dear attendees, greetings to each of you. Ukraine and the WHO have been linked by years of fruitful relations. In recent years, we have been experiencing a terrible pandemic. It seemed that nothing could be scarier, but it turned out differently. Russia's war has shown horrors we could not have imagined. WHO is committed to protecting the most crucial human rights to life and health. Now, they are both being violated in Ukraine. No Ukrainian, neither adults nor children, can be sure that they will wake up tomorrow, that a missile will not fly into their house. Doctors cannot be sure that their ambulances will not be bombed on the way to reaching a patient. Today, there are health ministers present from different countries. This is especially important because we cannot now ensure the life and health of Ukrainians on our own. And your countries are coming to our aid. The battles will end. Every displaced Ukrainian will return. Each family will be reunited and wounds will heal. Destroyed schools, orphanages and hospitals in Ukraine will be rebuilt. But the consequences of this war, unfortunately, will remain for years and decades. This must be understood now. So one more challenge is the battle for the mental health of our people. Following what Ukrainians have experienced during the occupation, at the front, in bomb shelters, under shelling, and abroad, they need rehabilitation in the same way as those who are physically wounded. I can cite many terrible examples, but I will cite one that demonstrates the scale of the phenomenon. People have been hiding in the Kharkiv subway during all 3 months of the war. Not just hiding, they live there, with children and pets. Because all these months, Kharkiv has been under shelling. And now, when the subway is due to run for the first time since the war, it turns out that there are hundreds of people who have never come up to the surface after all this time. And now they cannot psychologically force themselves to come up. Perhaps we could call this a bomb shelter syndrome. Perhaps WHO experts already have a name for this phenomenon, but it's important to understand that this is how many Ukrainians feel. Ukraine is one of the few countries in the world to be selected for the WHO Global Special Initiative on Mental Health. Right now, my office, together with representatives of the Ukrainian government, in cooperation with our civil society and international partners, is launching a nationwide initiative to enhance mental health and psychosocial support. And we want to do it with you, based on your best practices. We count on your expert support to build a truly unique and best quality psychological care service. Yes, we do have an ambition to do this, and we have the ambition to do it quickly, so that along with the victory in the war, we will also gain this victory over the grief, shock and stress of our citizens. My husband once said, "The president cannot change the country alone." But what can he do? He can set an example. I hope that today Ukraine will set an example to strengthen global support for the mental health and psychosocial well-being of war survivors. Yes, war is a tragedy, but we must find an opportunity to do good even in the midst of the horrors of war. Let us use this period as an opportunity to integrate psychological support into all the areas of peaceful life. I hope that we can count on your support. Let's gain this victory together.
Je vous remercie. Je remercie la délégation.
I thank the delegate of Ukraine.
Me donne Merci, je donne maintenant.
Thank you. I now give the floor to the delegate from the United Kingdom. You have the floor.
We gather here today in a peaceful European city with no need to fear the sound of incoming missiles or artillery, or to fear rape and execution at the hands of invading troops. But just a few months ago, the people of another European city enjoyed peace and security too. But now, Mariupol has been completely destroyed by Russian troops, just like many other towns and villages in Ukraine, as we just heard from the First Lady. As a group of nations, we cannot be pro-health, pro-humanity, without being against such brutal violence. Not least when at least 200 healthcare facilities and workers have been attacked by Russia, as verified by the WHO. So it is absolutely right that we vote on a motion condemning President Putin's unjustifiable aggression. And I welcome the deeply felt concern expressed by the Director General's in his opening address about the tragic impact of war. But we know that speaking words of comfort in this conference centre is the easy bit. So I want to pay tribute to all the healthcare workers, including WHO staff, who risk their lives in conflicts and crises like the one that we are witnessing in Ukraine today, some of whom pay the ultimate sacrifice, as we have witnessed in Afghanistan. As it turns 75 next year, the WHO is more important than ever. I congratulate Dr. Tedros on his nomination for his second term leading this vital institution. Working together, I know that there is much more that we can achieve, and there is much more to do. Nearly 2.5 years since the beginning of the pandemic, the moment has come where the talk of learning lessons must turn into concrete actions. I'm pleased that the intergovernmental negotiating body on the new institution is in full swing, that this process has the UK's full support. Only by working together will we emerge stronger. Allied to that effort is the 100-day target, the mission to make safe and effective vaccines and therapeutics and diagnostics available within 100 days of a public health emergency of international concern being declared. So we must rise to meet this future health emergency challenge by supporting speedy science. And to do that, it's time for a step change in how we do clinical trials across borders, especially when it comes to sharing data and sharing standards. We need stronger national clinical trial capabilities, greater collaboration, and sharper prioritization of health needs. And I'm proud to present a resolution on clinical trials to this Assembly alongside our co-chair, Argentina. Because vaccines were a product of clinical trials and selfless volunteers, just as much as they were a coalition of industry, science, and government. Clinical trials will also be vital in future health challenges, including that silent pandemic of antimicrobial resistance, which represents a huge existential threat. With health threats like this, just as the global pandemic, we are all of us, we're on the same side. So we must draw on expertise and experience wherever we find it. So in that spirit of One Health, there is clearly no health basis to justify not including Taiwan as an observer of the WHO, not least because of the role that Taiwan has played in sharing information with the rest of the world since the beginning of the COVID-19 pandemic. And finally, a strengthened global response to pandemics also requires a strengthened WHO. At this WHO, the best way that we can show our support for the WHO is by approving the financing and reform package that is on the table. So I call on my fellow health ministers to join me in backing these measures and for all of us to live up to our values of global peace, cooperation and inclusion. Thank you. Merci beaucoup.
Merci, honorable.
I thank the distinguished representative of the United Kingdom. Your Excellencies, dear friends, we've come to the end of the list of speakers for this morning at this point. We therefore must adjourn, and I'd just like to share some information under item 1A. Committee B won't be able to begin its work until the conclusion of item 3 of our agenda. Therefore, Committee B will begin its work on Wednesday, 25th of May at 9 o'clock in the morning, or after the conclusion of item 3 in plenary, depending on which comes last. I'd also like to remind you that the Credentials Committee will take place at 2 p.m. today in room 22. The third plenary session will meet again this afternoon at 2:30 with the continuation of the consideration of item 3. And the list of speakers, which I have before me, will begin with the distinguished representative of Paraguay. The plenary meeting this afternoon will end at 6:30 instead of 5:30 p.m. The meeting is adjourned.